so good that we've finally been able to catch up after all of the toing and froing and working out a suitable time. So how are you going?
Yeah, I'm sorry it's taken so long. It's been a busy few weeks. I was on annual leave and then my partner had surgery and it's just been hectic.
Oh, tell me a bit more about that.
He's been pretty unwell, to be honest. I'm hoping he's on the improve. I'm a bit worried about him. It's been pretty tough because we don't really have any family here in Victoria, so there hasn't really been a lot of support. But don't worry, I'm pretty organised and I think I can keep on top of it all.
Well, I get the sense that you're really organised, but I know also how difficult it can be when somebody you really care about is unwell. You're a doctor, you're also their partner, you know, there are conflicting things going on and you worry, don't you?
Yeah, it can be really difficult actually because, you know, you want to do things and your family think because you're the doctor in the family you can do things, but you and I both know that it's best to be hands-off with these sort of things.
In this situation, it's better to be the partner than the doctor, isn't it?
Yeah, it's just a hard space to work.
Yeah. So from when I was younger and my husband got pretty sick, he got sick with meningitis and he was sick for weeks. And at first I didn't really know what was going on and then I was thinking the worst. And then finally he was diagnosed and he was in hospital for ages. We had 2 little kids. I was worried about whether or not he'd get better. I was working in emergency. I was really sleep deprived. I was falling asleep in the tea room whenever I could catch a break. And I remember very vividly how hard it was to try and detach myself from being a doctor and just try and be the supportive partner and leave the medicine to the treating doctors. It's not easy, and I know for you it might sort of be the same.
Yeah, and it's really good advice that needs to be compartmentalised. For the most part, I think I've got it under control, but it is a new space for me and it isn't easy. I guess the main reason I got in touch with you specifically for this Dr. JuMP mentoring program is that I saw that you have that emergency experience. My long-term plan is to go back out to a rural community and probably live on a property, and so I know that I'm going to be based in a smaller hospital and I'm going to need that emergency experience going forward, so I was really hoping to collaborate with someone who had that expertise.
Well, I think you might have come to the right person. I've worked in emergency in a rural location for ages now.
Awesome.
It's really, really gratifying, and for a whole lot of reasons. First of all, you're in a small community, and as a GP, you don't just see your patients in a 9 to 5 environment. You are available to them on not every night of the week, but on certain nights of the week, and so patients you're familiar with might come in an emergency presentation and you already know their past medical history and what medications they're taking and how many dogs they've got and all sorts of other things that are really important. And so that can make the difference between whether or not they actually stay in hospital. And the other thing is that they feel comfortable because they see a familiar face.
Yeah.
And I think that's awfully important for people in an emergency department where, you know, there's screaming people in one cubicle, there's a crying baby in another, and there's all sorts of other things going on. So yeah, it's great mixing those two things, and it just gives you a little bit of a break from 9 to 5 GP work. You get to mix it up a bit.
You've really touched on what's really awesome about rural practice and you've got me a little bit excited, so that's good.
Well, I'm glad about that.
So how do we work through this mentor process? How does it work?
Well, my understanding is that we need to schedule regular discussions or conversations. They don't necessarily have to be face-to-face like today, although today's great.
Yeah.
And I'd like to do that as often as we can, but we live a long way apart at the moment, so it might be an idea to put in some Zoom meetings or phone, whatever works best for you. I can do Zoom, and we can sort of work on some sort of making it as frequent as you want it to be, but regular, so that we don't lose touch. because I've had that happen before where if we haven't scheduled things, we haven't caught up, and it's been 6 months or more before we've actually managed to catch up. But if we've got a set time, then we work our lives around that time, and that's as important as we make it.
Great. I think Zoom would work really well for me because, like you said, I am a few hours away at the moment, and if I end up closer in the future, then we could talk about doing things in person too. I'm just a little bit nervous about between GP training, there's a few personal things going on, you know, not making appointments or having to change things around. Do you think that will be all right?
Yeah, look, we can both be reasonably flexible, but I guess the point is that let's say we schedule a meeting in about a month's time, and you can't make it. So you will need to contact me and say, I can't make this meeting. And so at that point, we'll schedule for a time that suits both of us so that we've always got something scheduled.
Awesome.
How's that sound?
That actually sounds really good. Shall I do the invites for the Zoom?
Yeah, sure. You
Sounds
go for
good.
it. I'd rather you did it, actually. I was telling you I was familiar with Zoom, but I'd rather somebody else schedule the invites, if that's okay.
Awesome. Sounds good.
All right.
Alrighty.
So
we'll have to organise that.
Yeah. So a month, do you reckon, or 6 weeks? What do you
Let's
think?
start with 6 weeks just with everything going on, and then I'm more likely to be able to keep up with that. What do you reckon?
Okay, that's absolutely fine with me.
Sounds good.
All right, good. I'm excited.
Great.